I have something. And no, it's not a disease. I have something that is so exciting that I'm going to be telling you guys at the end of this video. So stick around for it because you are not going to want to miss this. It's a chance for you guys to win something. And it's not just a random chance. You guys are going to have the ability to create your own destiny with this. I'm going to go get changed for the gym. I'm going to film this video real quick right before I leave, and then I'm going to tell you this awesome announcement. So obviously I'm not a doctor. All this stuff could be completely false, so you need to do your own research. It's not intended to be substituted for professional medical advice, and I don't recommend or condone anyone use Sarms or steroids. It's stupid to do. Those are not safe compounds. Okay, let's get into it. One of the biggest things that guys are afraid of when they take Sarms or steroids, testosterone, whatever it is getting gyno. That's right. These nipples just swelling up, man. No one wants that. And that's honestly a pretty terrifying thing because it doesn't look good. It can be painful. You can start like squirting out green liquid from your nipples, which is not normal, let me tell you. I did have a friend who, he started taking some stuff and legit, I mean, some liquid started coming out. So that's just kind of a terrifying thought, not to mention it just looks absolutely horrible. So, there's really only two ways that you can reverse gyno from Sarms. I'm going to talk a little bit about prevention as well, but mostly I'm going to be talking about reversing. So the first way is surgery, right? You have to get surgery and you remove the breast tissue gland. That's one of the ways, and that's a permanent fix. After you have that, you're not going to have to worry about gyno anymore because the gland is taken out. It's done. No more worries. If you look at pictures of The Rock in his early days of WWE or WWF professional wrestling, he had a little bit of gyno, and then you look at him later on, no gyno whatsoever, right? So he definitely had that tissue, the breast tissue gland taken out, right? So that can cost usually around $5,000 to $6,000. If you can get your insurance to pay for it, amazing. But otherwise, that's a pretty hefty price tag, and most guys who are just kind of experimenting with Sarms or steroids, they don't have that kind of money lying around to go get their nipple glands removed, right? So the second way is a short drug protocol with drugs like Novadex or raloxifene. Now, some of you probably haven't heard of raloxifene. I have no idea if I'm even saying that correctly, but I'm going to be talking about those a little bit as well. Let's back up a little bit. And what is gyno exactly? What causes it? So gyno is the development of breast tissue, and it results from excess estrogen in the body, right? That's why women grow breasts, is because they have more estrogen in their bodies than men. And we don't, thankfully, because we do not have that high level of estrogen in our bodies. But if you're taking testosterone, it can convert into estrogen if you have too much of it. And that's why some guys during puberty, they develop gyno because they're getting this increase in testosterone and their body doesn't quite know what to do with it. And so it converts some of it into estrogen. And a lot of times that can cause puberty gyno. So they may have not even taken anything, but they're getting it from puberty because their body is producing so much testosterone, right? So some of the early signs of gyno are when you get kind of small lumps underneath your nipples and they're a little bit sensitive. I can remember this from puberty. I can remember just kind of little lumps underneath my nipples and they were pretty sensitive to the touch, and that lasted for a couple years. Some of you guys might be able to relate to that as well. I never really got anything from it, thankfully, but I do remember that when I was going through puberty. So you could go the surgery route. Again, if you do have gyno from puberty, a lot of guys opt to go the surgery route because when you're 13, 14, 15, 16 years old, you don't really want gyno already. So, a lot of guys are self-conscious about this and they convince their parents, or as soon as they turn 18, they go get the surgery to get those taken out. And again, if you have that done, you never have to worry about gyno again. The other option, again, is those drugs. So one of those drugs is called Novadex. And if you know anything about Sarms or steroids, you're going to hear of guys using Novadex in their post-cycle therapy or while they're on cycle, right? And why do they do that? Because it is what's classified as a SERM, which is a selective estrogen receptor modulator. Not a SARM, selective androgen receptor modulator, but selective estrogen receptor modulator. And basically it works by targeting estrogen receptors around your nipples and binding to them without activating them. So essentially, it helps reverse the effects of gyno by kind of blocking those estrogen receptors. So many people believe that Novadex will actually help prevent gyno, and that couldn't really be further from the truth. Novadex is a band-aid to the actual problem, just like, you know, Advil is a band-aid to your headaches or chronic pain. Novadex is a band-aid to the actual problem, and it can reverse gyno that has already been done, right? So it does not actively prevent gyno from occurring though. And now the same is true for this other drug that I mentioned, which is raloxifene. It's a lot less common for guys to be using raloxifene, but studies have shown that it may actually be more effective in reducing gyno than Novadex even. This study compares the effects of raloxifene to Novadex or tamoxifen for reversing gyno, and there were a greater percentage of patients who were treated with raloxifene that saw decreases in breast tissue development. So it may be more effective than Novadex. Now that I've kind of told you how to reverse gyno or get gyno taken out surgically, what are some ways that you can actually prevent gyno from taking place in the first place? Because let's be honest, if you're going to be taking something, you want to know, how do I prevent gyno from even occurring so I don't have to deal with maybe getting a surgery or trying to reverse it, right? So most guys take an aromatase inhibitor when they're on a steroid or Sarms cycle to prevent gyno. Now, what an AI does is it prevents the aromatization of estrogen, which prevents any estrogen in your body from causing the issue of gyno, right? So that sounds awesome. Okay, so your body already has a certain amount of estrogen floating around in it, and if those levels are a little bit higher due to the Sarms or steroid use or testosterone converting into estrogen, right, then an AI will help, but it probably won't be able to prevent anything. So that's why it's good to take an AI like Clomid as well as a SERM like Novadex or raloxifene, right? So taking both types of drugs, they're going to help prevent the gyno from developing in the first place. And then the Novadex or raloxifene will help reverse any minor gyno that does develop. So obviously I'm not a doctor. All this stuff could be completely false, so you need to do your own research. It's not intended to be substituted for professional medical advice, and I don't recommend or condone anyone use Sarms or steroids. It's stupid to do. Those are not safe compounds, right? So take that with a grain of salt. All of this information in this video is really just my own opinion and is meant for entertainment purposes only, and it is not advice. Go talk to Dr. Greg Doucette if you want some advice on this stuff. And the moment you've all been waiting for. I am going to be putting together one of the best workout programs I've ever designed in my whole 8-9 years of workout experience for myself, for other people. I'm going to be putting together a 10 to 12 week workout program. I'm going to make that available for 100 people only. With that workout program is going to be involved a contest. I want to help you guys reach your goals. So many people ask me questions of, Lane, how do I do this? How do I gain this muscle? How do I do that? How do I do that? So I want to help you guys get to the physiques that you want in 10 to 12 weeks. If you want to gain 50 pounds of muscle, then that's not going to happen in the 10 to 12 weeks. But those 10 to 12 weeks on this program are going to kickstart your growth like you've never seen before and help you get one step closer to that ultimate end goal. You're also going to be entered into a contest. And again, it's only 100 people that are able to get into this and get this workout program and enter this contest. Out of those 100 people, one of you is going to win $2,000. I don't know all the details of this yet, but this is something that I really want to do. I think it can help a lot of you guys. What this is really about is giving you guys a program, guidance, one-on-one coaching that is going to help you reach your goals of where you want to be, what you want your physique to look like. So that's the main goal of this. More details on this coming up in the next few videos. Once those 100 workout programs are taken, then no one else is going to be able to enter. No one else is going to be able to have access to this.